Thank you so much for that really kind introduction, and it's my honor and privilege to be here with you today. So I really look forward to our discussion. Everyone see my screen okay? Just do a quick check here. Great. Continue. There we go. So I am going to be talking to you today about the policy implications for the recognition that climate change affects not only our health, but also our delivery of healthcare. And so with that, I want to kind of start out with three key messages that I hope resonate kind of through the next half an hour of our discussion, in addition to hopefully kind of continuing into some of the discussions that you all will be having. So the first is that climate change is truly a meta problem. So that is a problem that sort of underlies many other key issues that are facing our society at this time, but also a threat multiplier, recognizing that it is also making those problems worse. And that this threatens not only our public health infrastructure, but also sort of healthcare's core tenets, and that's having the optimal access to healthcare, the balance between cost and optimal and high quality care. The second is that by adding what I call a climate lens to healthcare policy, both globally and I think obviously more relevant, given that we have a new administration, is domestically, that's actually a prescription for better health and health equity. And the third is that compounding crises, while they can seem overwhelming, that actually means that there are interconnected solutions, which are going to allow us to tackle multiple challenges simultaneously. So with that sort of as a preview of the themes I hope arise out of the next half an hour, I just wanted to start with that, for me, I very quickly, when I first learned about climate change and recognized the true implications that it has, not only for my practice in emergency medicine, but also for the public health work and public health spheres that I interact with, is the recognition that this is fundamentally a health equity issue as well. And so I began to see it in the patients that I cared for, whether that was the elderly gentleman with heat stroke who was living in lower income housing during record-breaking heat, to the woman that was displaced from Puerto Rico and had lost access to her medications and to her healthcare infrastructure. So all of this meant that I was seeing it in my day-to-day practice, and quickly recognized that the way I think about our current knowledge of how climate change is impacting health and our healthcare system is an iceberg. Now, I recognize that is a little ironic given the impacts of climate change, but the recognition that what we see above the surface is only a glimpse of what I really fear are the true interconnections, both especially the indirect and the insidious ways in which climate change is not only harming our health, but disrupting our public health infrastructure and our healthcare systems. I mean, for example, there was a study that came out that showed that rising heat has actually been linked to increasing microbial resistance to antibiotics. Now, for any practicing clinician out there, that is a frightening thought. But even if we look through the headlines of our current moments, and again, my thoughts go out to anyone has family or loved ones that are impacted by the current extreme weather situations happening around the US. But as we see these massive power outages that have been occurred, secondary to a polar vortex, which is intricately connected to climate change, that these power outages are also impacting hospitals and the headlines of hospitals that are unable to actually have access to clean drinking water or being able to flush their toilets. All of this, again, has these insidious underlying connections to climate change. And that is the mass underneath that we need to understand, because we can't prepare for what we don't fully understand. Because the recognition is that oftentimes in my clinical practice, I like to look in a rearview mirror. It's reassuring in the sense of look at a patient's old urine culture in order to understand what antibiotic I should prescribe to them for their current urinary tract infection. But the reality is that we cannot look in a rearview mirror for what lies ahead for our public health and healthcare systems. And so the future is uncharted, again, necessitating an evidence-based pathway forward as we grapple with how to not only tackle climate change at its root cause, but also build in the inherent adaptation and resilience that is critically essential for us to have optimal health and take care of the very tenets of what our healthcare system and public health goals are, which is to improve health and save lives and to address health equity. And the reality is that we are dealing with converging crises of a truly unprecedented scale in modern time. And so, as we think about the COVID-19 pandemic, which has laid bare not only these interconnected challenges between the public health system, that when that fails, then inevitably that burden falls to the healthcare system. And so the public health and healthcare systems are intricately linked, and we have to think how to optimize that relationship and again, sort of rise above these converging crises with interconnected solutions. And all of this is happening on a baseline of health inequities that have been exposed and laid bare before the public in a way that I think hasn't happened in modern time in regards to the ways that systemic racism has truly created disproportionate health burdens for populations around the US. And again, climate change as that meta problem and threat multiplier are only exacerbating these. And we highlighted this further in trying to highlight this both in the 2019 Lancet Countdown US Policy Brief, but also in our 2020 release in December, where there was a wonderful case study that was written by many authors from California. Were on this, written by the working group, that really tries to help exhibit how these different challenges are interconnected and how our solutions thus fundamentally must be as well. Because reality is that as we think about our day-to-days within the healthcare system, and again, that is independent of public health, related other health fields, the traditional sort of healthcare sector and clinical practice, and a range of roles within that healthcare system. So from nurses to physical therapists to social workers to physicians. All of that is recognizing that climate change is directly, indirectly, and again, fearfully, kind of insidiously impacting all facets of our current practice. And obviously, just a key examples to highlight, and we could spend a whole session just on this alone, but thinking about the medications that we're prescribing patients. How do we need to screen patients for risk, not only for exposure to extreme heat, for example, as outdoor workers, or individuals that do not have the ability to have access to cooling. And as we think about the description of climate change as global weirding, to quote Dr. Catherine Hayhoe, that recognizing that not only do we need to think about the issues and how climate change is exacerbating the heat aspects around the country, but also now thinking about extreme cold temperatures in regions that have not experienced these and thus don't have the infrastructure. And so how do we think about power outages, not only for our healthcare delivery within hospital systems, but for patients who rely on different durable medical equipment that they need to have access to and requires power to run their oxygen or their nebulizer machine, or to keep their insulin from at an appropriate temperature, whether it's not, extreme heat or extreme cold. I saw in some article recently about insulin was freezing for diabetics. Now, all of these, right, are sort of these unprecedented, uncharted territory for all of us, but we have to systematically and comprehensively begin to try to understand these. And this really always resonates in my mind, this quote. And I remember when the 2018 Lancet Countdown came out, that I was asked, I think, by a reporter about what quote or what piece of that report kept me up at night. And it was this quote, which I think, unfortunately, we have continued to see and play out in sometimes, again, those surprising and insidious ways, even in the few years since this has been published. And that's that climate change has the potential to disrupt core public health infrastructure and overwhelm health services. So what does all of that mean, right? That can be enormously depressing. And if you're, for all of you who think about this, and especially for those of us that work on this day in and day out, it's the hope that it brings me is, again, that recognition that yes, all of these things are interconnected and it is a challenge, but we can add a climate lens, as I'd like to say, to these current issues to really develop a solution focused path forward. And what is a climate lens other than, I'm a photographer, not so much anymore, and don't do it in my hobby as much anymore. But, the recognition is just to look through whatever it is that you are analyzing or thinking about, whether this be a policy or a hospital, policy or administrative procedures, is just to think about how is climate change impacting that now that we recognize, right? Acknowledging that there's a lot we still don't understand. But how is that also going to potentially influence it in the future? And how can we, again, either gain the information we need in order to better understand it or in order to better prepare for it? And again, this recognition too, that as we think about solutions for one problem, that as we know, these are all interconnected. Again, whether we're looking at preparing for the current and next pandemic, for thinking about how to prepare for the challenges of climate change, or in order to face our long overdue reckoning with systemic racism. All of these, right? We can interconnect these and align these lenses and ensure that all of the solutions can be targeted in some way and harmonized in order to tackle these problems together. So let's start with kind of a global perspective on sort of putting this concept into action. So there was a paper that I published with a colleague of mine in 2019, looking to see how climate change threatens the achievement of universal health care. And this is recognizing that, right, as you look at this map of the Sustainable Development Goals, I'm really struck by, all of these things are sort of independent within their respective boxes and almost give the illusion that they are discrete, concrete concepts. And if you pull out three of them, or two of them, which 3 and 13, thinking about, one of the SDG goals of having universal health coverage across the world, but then also having climate action, that these in fact are a perfect example of these need to have harmonized solutions and integrated conversations. And oftentimes this really goes against sort of the very fibers of how we structure academia, for example, or even our hospitals, right? We have different departments, both in both of those spheres. And thinking about how we can begin to bridge across these different areas and have the integrated multidisciplinary conversations in order to ensure that we can align all of the lenses that we know about. And then more importantly, to make sure that all of the lenses and perspectives that we need are truly represented. And so from a global standpoint, thinking about the ways in which climate change are causing a variety of exposures that threaten not only sort of our changes in disease burdens, population displacement and migration. And again, this is on the global scale. So thinking about climate refugees, rising poverty, the disruption of healthcare infrastructure and care delivery, again, across all low, middle, and high income countries, and then healthcare workforce disruption and impairment. Now, all of that, right, is impacting those very tenets of universal health coverage, which I had, hinted at the one of the key messages. And that is thinking about access, quality, and affordability. And I'll dig kind of more into those and how that is really pertains to sort of domestic healthcare policy. And so thinking about how we can achieve universal health coverage, right? We're recognizing that climate change thus is acting against and threatening these very core tenets and our success at achieving these core tenets. And in order to exhibit this a little bit further, this is a map, which I kind of want to just take a minute to talk through. And so as you look at these colors, you'll notice obviously the yellow colors seem to stand out a bit more as you look at the two maps. Now, the map on the left actually highlights, based off a climate vulnerability index that was created by Notre Dame. And that looks at countries that have significant climate vulnerability are thus exhibited on this map in yellow, saying that they have very high vulnerability to climate change. Now, if you look at the second map on the right, that actually highlights the Universal Health Coverage Index. So, in essence, sort of how, on a global scale, how well a country has been able to fulfill kind of the SDG goal of having universal health coverage. And then that, thus, yellow is signified by very low. So obviously, these are, if you are a country that's exhibited in yellow in both of these maps, it is a perfect storm combination where you have the highest vulnerability to climate change, but you also currently have the lowest coverage of universal health coverage. And so thus, as you think about, how we can again align these solutions, you can see that these again are fundamental issues in again the very countries at which we need to best tackle UHC, also are thus have the highest challenges around climate change. So obviously that can be, as just food for thought to kind of paint the scale on a global landscape. Because as you see, based off a global comparison, we are purple on this map in the United States. And hence we have very low climate vulnerability, again, from a global comparison, and then very high UHC, which again, in a comparison, because obviously we have a ways to go to have true universal health coverage in the US. But with that as a perspective, then sort of moving to how we can think about, adding a climate lens to health policy in the US. And this is where the rest of the time really will be focused. And this was a paper that was published with some colleagues in Health Affairs in their wonderful December issue that focused on climate change and health, and had a wonderful plethora of articles and potentially other authors are on the call as well. And I highly encourage you to spend time sitting by your fake or real fire during these winter months, at least for me here in the East, and read that issue. And the outline of this paper is sort of as follows, as far as to think about, again, what this access, cost, and quality really means in a tangible level. So again, this just highlights, some of the pathways that we understand best. And I would say extreme heat is probably the one that we best understand. But again, there are potentially, many others that could be listed here. But as climate change creates these harms to health, and again, I sort of have that next level of the public health infrastructure and healthcare system, and try to show kind of with this line, and just to really reinstate that, both of these infrastructure is intimately connected from both a population level effects and patient level effects. But all of that thus has implications for access, cost, and quality. And so just to sort of highlight, some examples around how climate change can lead to decreased access to healthcare. As we think about its impacts on poverty, for example, then you could think about the increase in sort of the on or underinsured. As we think about the number of healthcare facilities in rural locations, and especially given the economic turmoil and fallout from the COVID-19 pandemic in hospitals that were already struggling in order to meet their sort of bottom line. And oftentimes, right, these are rural areas, can be some of those regions of the US that might suffer the most from certain climate exposure pathways. And then also thinking about the mismatch between not only the number of specialties or specialists and care providers that are required. So for example, thinking that there is already a shortage of infectious disease specialists, and thinking about that as climate change, again, continues to alter the burden and the geographic distribution of infectious diseases, especially related to vector-borne infectious diseases, are some of the best described. That what does that actually mean then for the geographic location of future health professionals in order to ensure that we can have a workforce, healthcare workforce, that is both appropriately geographically placed and has the right specialties to meet the disease burdens in the right locations in the future. Moving to the second box, thinking about higher costs. So again, sort of that theme of the altered and increased disease burdens. How is that going to impact overall costs? And how are these healthcare delivery disruptions going to impact cost as well? And some of the figures for cost of extreme weather events to just individual healthcare systems has been in the billions. And what does that mean then for the shift in sort of these financial burdens between not only healthcare facilities, but payers and patients themselves? And then thinking about the quality aspect and how is this impacting potentially lower quality of care? Again, as we think about potentially less hospitals in certain regions and increasing disease burdens, what does that mean for hospital overcrowding or in my emergency department? What does that mean in regards to supply chain disruptions and having the right equipment that is needed in order to treat the conditions in front of us? What does that mean for the challenges of displaced populations? And as individuals become internally displaced within the US and thus lose access to their own healthcare system, what does that mean when they show up at other healthcare systems seeking refills of medication? How do we appropriately transfer that medical information in a way that is adaptable and resilient? And then thinking about sort of the healthcare professional impairments, and there's literature thinking that exhibits how, for example, heat can impair cognitive abilities of humans. And healthcare workers, we are humans. And so if, for example, you're working in a hospital that had a power outage, oftentimes the backup generators do not actually supply cooling devices. There was actually a example here in Massachusetts where there was a outage at a hospital on a 90-degree Fahrenheit day, so not that hot. And they actually had to evacuate individuals from the upper levels of the hospital because it was becoming not safe for patients due to temperature changes. And some of the radiographic equipment was overheated. So even after power was restored, it actually took a few hours in order for that equipment to come back online. What were the healthcare providers? How were potentially their care impaired? So all of these can collectively and others, lead to worse health outcomes and exacerbation of health disparities. So then kind of thinking through adding kind of a climate lens to US health policy. So we give some examples of what it really means to sort of add this climate lens, again, to these three sort of structures: public health infrastructure, healthcare delivery, and payers. And for anyone who's interested, obviously the paper kind of goes into this in much more depth. And the goal of it really is to provide some examples and be policy relevant, kind of much more than per se policy prescriptive. But one of the keys is how can we have a data-driven approach? So how can we determine who is vulnerable and identify these individuals, and then develop interventions that can be evaluated? And this example could use, the NIEHS or the CDC's sort of racial and ethnic approaches to community health, which is also called REACH, as an example. How can we develop sort of national surveillance around climate-related health risks and actually have real-time updates that can really garner the collective federal entities that have the scientific expertise? How can we coordinate sort of resilience planning for hospitals, both on a national level, but then also recognizing that hospitals have very unique, locally relevant challenges because of the diversity the US experiences in regards to climate exposures? Thinking around healthcare delivery, how can we help healthcare systems decarbonize? Because again, we have to get to the root of the problem, and we can't have healthcare itself contributing to climate change. But how can we create incentives, perhaps through Medicare CMS reimbursement, or kind of creating green loan funds in order to allow hospitals who may not have the initial startup capital required to take the actions for decarbonization, which in the end are actually cost saving? How can we, create resilient infrastructure and supply chains, and again, really work across the sectors federally and on state and local levels? That interoperable sort of information flow, as we talk about, is sort of that idea of, how could we create a chart that is portable for individuals that can be easily accessed? I'm sure any clinician that's listening sort of knows the challenges of someone who comes from another hospital and not being able to access their records. And if we anticipate that internally displaced individuals will occur more frequently, then how can we create a system that allows for optimal transfer of information? And how can we create a climate-ready workforce, not only from a knowledge standpoint, but again, thinking about the research we need in order to fill the gaps. How can we tackle sort of the mismatch and shortages that currently exist and may become exacerbated? How can we ensure that clinicians have the breadth of skills that's required in order to meet the challenges that are ahead? Should every, obviously in emergency medicine and have a really broad background, but how can we also provide specialists, for example, backgrounds that will allow them to work within disasters? And then address kind of our own impairments potentially in some of these situations. And then lastly, thinking around payers, and again, how can we optimize Medicare and Medicaid infrastructure to really allow them to tackle the health-related social needs? So whether that's giving greater attention to thinking of housing and weatherization of homes and air filtration systems and access to cooling or heating, and having flexibility within ACOs in order to allow people to target the specific needs of their population. And then also, how can we have incentives again for decarbonization and even making choices clinically for solutions that are carbon neutral, and especially if there's multiple choices, how can we incentivize solutions that have a lower carbon footprint? And all of that, again, can get to the root cause of improved health outcomes and reduction of health disparities. So all of this is, sort of recognizing that we are at a moment where we have an administration and a mentor of mine, Gina McCarthy, who is at the helm and recognizes that health and health equity are truly a prescription for improved health and health equity in the United States. And on their climate day at the White House, as they called it, and they released this executive order, I heard health sort of interwoven kind of around all of their discussions around climate change, and also recognizes President Biden discussed it, that he discussed about the economic and job impacts. But the second thing he mentioned was around the impacts on health and how the health benefits of climate action. And so there is an enormous opportunity as they take the sort of all of government approach to really tackle these converging crises and have interconnected solutions that can allow us to tackle multiple issues at once. So back to my 3 messages. So climate change is, again, that meta problem and threat multiplier. And I hope I've shown, at least on an introductory level, how it really does impact some of the core tenets around access, cost, and quality. Now, there's a lot that we still don't know around all of those different issues, and thus we need to ensure that we have the research infrastructure to create the evidence-based path that we need in order to guide our actions ahead. And the second is that adding a climate change lens to healthcare policy, both globally and domestically, can be a prescription for better health and health equity. And lastly, that we know that these compounding crises, again, mean interconnected solutions. And while that can be overwhelming initially, I hope you very quickly move to the enormous opportunities that lends itself to, and the fundamental need to have multidisciplinary conversations and add multiple lenses so we can rise above and tackle these multiple challenges simultaneously. So at the end of the day, I will not give up my practice in emergency medicine because it allows me to kind of see that patient level to meet the individuals with which kind of the broader work is hence influencing. And there is nothing more inspiring for me than being in a room in a resuscitation where there is a team of people who are joined together in that common mission to save the patient. And we collectively, as a healthcare community, we are in one of those resuscitation bays. And I am given so much immense hope, not only by looking around that room, hence all of you, and looking at the work that you are doing, but also recognizing that we have all of the treatments and materials that we need in order to tackle this crisis. We aren't left without our toolbox. And there's a lot right now in the country that divides us. And unfortunately, that oftentimes makes much more headlines than what it is that truly brings us together. And climate change can be that issue that not only sort of unifies the health community around this, but also recognizing and unifying kind of the broader country and globe as we really seek to try to tackle this problem together. So with that, I look forward to your questions and discussion, and thank you so much for your time.
Thank you so much, Dr. Salas. That was so informative and inspiring. We have so many great questions still trickling in. I encourage everyone to keep submitting them. But yeah, I think we'll have an incredibly rich conversation. Yeah, maybe to start us off, I think just to sort of maybe kind of a more granular level understand some of the vulnerabilities. So I wanted to ask, like, what are the factors in the climate vulnerability index that are drivers for the US ending up so low? And I'm curious just how some of those same indices, like what has sort of played out in the COVID pandemic and what are the sort of the overlaps, and yeah, kind of thinking post-pandemic, how we might be able to address those vulnerabilities.
Yeah, so it's a great question. And I think it is as recognizing the numerous opportunities we have for improvement around climate change and, again, even universal health coverage within the US, that anytime there are these global comparisons, I oftentimes sort of internally cringe when I see them. The same is true as you look at some of the Lancet countdown indicators, and as I, sort of get some of the disaggregated ones for the US, that oftentimes we look as if we are, we're on a path of success, and clearly we are not. And that's where I think, first off, just parallel, I should say, framing that data of it's looking at sort of comparisons across countries. So yes, we may have more resilience than in other countries, but we still have obviously enormous vulnerability. And so, interestingly enough, the sort of that vulnerability index doesn't even necessarily incorporate really a lot of the ones that I think are really central to health and healthcare. And so a lot of it sort of looks more towards generalized, other buckets of exposures. So obviously I can throw that in the chat and, provide kind of some more background information in regards to their, very in-depth methodology. But I do want to note that, really as you think about kind of the core tenets of health and healthcare, that unfortunately those even aren't necessarily included.
Yeah, next, I think throughout your talks sort of stressed, the role of sort of health providers and sort of the need for data and research-driven action. But so often, as we constantly see play out, politics sort of gets injected in the mix. And so I'm really curious sort of how you navigate that tension and sort of how you think we can kind of see our way out of the politics that are often standing in the way of bold and inspired climate action.
Yeah, it's a great question. And I think my approach, both personally and professionally, is that, if I'm sitting in an emergency department with a medical student or a resident, we frame that conversation around that patient's care and what we can do to best provide the services and improve the health of that patient in front of us. And if we use that as our fundamental driving goal of all of the care that patient receives, not only in the emergency department, but within the hospital, then, even if we reach out to a consultant and they give pushback because they don't want to necessarily be involved in that discussion, again, if that's what's best for the patient, then we need to move forward. And that is really the fundamental tenet of that I use within my climate work. So whether it's my patient kind of proverbially in front of me in my emergency department, or kind of the larger, patient at large, thinking around a population level impacts, that if we put the health first and health equity as our primary driving goals, then to me, there are no politics of that. And so people can say what they will, but if that is our driver and that is the driving fundamental goal of how I frame climate action, then to me, there are no politics within that. So that is sort of how I address it. And that is sort of my standing base and how I responded to questions, for example, during congressional testimony.
You mentioned you work with health professional students, and so I'm super curious, one, what you would want sort of the current training generation of physicians to know, and then second to that, how can health professional students contribute to this work now and also combine their voices to sort of push for institutional change? What are some of the strategies that you've seen work well at your own institution?
Yeah, well, I might start with your second question first, because there the next generation, again, not whether we are thinking about the impact that the rising generations have had on the climate movement with the youth climate marches and taking to the streets, both within the US and globally. And it's been phenomenal, right? And has been, I think, a fundamental core piece of this shift that we have seen in recognition of what climate change means for our health currently, our livelihood and our well-being now and in the future. So similarly, students and individuals in training, you can knock on that door of your dean and have a very different conversation. And you are empowered with, I think, much more capabilities than I think oftentimes people recognize. But you are the future, and you are paying for your education, unfortunately, which you will sort of recognize as you can continue forward and accumulate that debt. But it's well worth it, don't worry. But just recognizing, right, that you coming together around this issue and finding like-minded people within your institution, that you have the ability to educate not only leadership, but also kind of those around you. So one example of a sort of tangible thing you can do is that you're on, for example, rounds in the ward, and you have a patient who's admitted for an asthma exacerbation. Well, you can, for example, discuss how and bring up at rounds about how pollen levels are higher as a result of climate change. Or you can discuss the issues of air pollution, since we know it has climate change and air pollution have the same root cause of the burning of fossil fuels. So by bringing that up as a question, right, you are thus introducing and making these connections for others on the team and helping to show kind of these interconnected relationships. So that's just some examples. And then to quickly kind of tackle your other question in regards to, education. I mean, again, it's sort of so I was trained at the Cleveland Clinic Lerner College of Medicine, and we had, it's only 32 students per class, and we had a problem-based learning format. And I think, one of the things I really took away from that was this constant recognition that there is such an evolution of information and what we need to know in order to be clinicians. And so identifying what it is we need to know, not only to treat the patient in front of us, but kind of thinking about our global career ahead. So, just like on a shift, right, there's not uncommon, I look up the latest recommendations or guidelines. And so we're constantly having all of this information stream. So thinking about how we can, again, incorporate sort of a climate lens into not only our medical education now and framing, but also thinking about how we can start to build these resources electronically that need to be accessible to all of us, because we can't, always be up to date on the latest information. So that is sort of a way to, again, think about how to incorporate, again, a climate lens into education. And last thing I'll say on that is that, oftentimes educators or leadership at a medical school may question how to add something else within a curriculum, because there already is so much, right, that we need to know. But again, recognizing we're really trying to equip ourselves with how to identify what we don't know, what we do know, and where to find that information. But I think more importantly, that we can add sort of, again, that climate lens to what you're already learning. So if you're using the asthma example again, you need to learn about asthma. Well, think about, as you think about the underlying pathophysiology, think about how climate change is impacting that. And that can be one slide, in a big lecture. So it doesn't, in my personal opinion, integration into an existing curriculum is much more sort of fundamentally representative of what clinical practice is and the true underlying realities of how climate change is a threat multiplier.
Yeah, I want to sort of touch on equity and environmental justice communities have often and long been left out of mainstream conversations around environmental and climate policy, yet bear the brunt of health injustices like increased pollution, and often the very communities are left out of our healthcare systems. And so I'm curious how you think about addressing climate change through health policy while putting overburdened and often under served communities front and center.
Yeah, I mean, first and foremost, I think that I often say sort of putting climate action and putting, health and health equity sort of as the primary driver of climate change. But I mean, you could just say just health equity as front and center. And so I think it's recognizing that, first and foremost, but also the importance of really having that affected communities having them at the table and having their voices represented. So this has to be done sort of in a collective approach. And so we not only need to advocate for these patients, because oftentimes their voices are silenced in a way that is irreprehensible, and we need to address that. Making sure that, again, they're at the table and that their voices are heard and we understand what their issues truly are. And then 3, again, weaving that into the very fibers of health policy and recognizing that, we, if we value health equity as a country, then we need to ensure that our policies and our use of finances appropriately represent that foundation, and that it's not just something we say within words, but is not actually represented in the very fabric of the policy that will lead to kind of that wide and systemic change.
Thank you so much for that. We have time for a couple more questions. If that's okay with you. Let's see. I'm wondering if you can speak, sorry, last question. Yeah, give a few examples about just how just your deep knowledge about the climate crisis has affected your clinical care as a ED doc.
Yeah, that's actually an area I wish I had more bandwidth to think through. And thankfully there are others who are seeking to do that. But I think for me, it's just, again, the recognition of that in my emergency practice, that I am meeting individuals at a time where I really have a profound opportunity for intervention and education. I think for anyone who's emergency medicine, or perhaps this meets stereotypes that other specialties may have, but we are limited in scope on what we can address within a very short, condensed visit. Where oftentimes we are having to address sort of the public health needs of our emergency department, hence volume and resources and limited personnel. And so we may often say, right, follow up with your primary care doctor in order to address X, Y, and Z, because we've addressed these other things. But as we think about the way in which climate change is impacting that patient's health, and for example, if we're seeing them in the middle of a heat wave, they may not be able to see their primary care physician until that heat wave is over. And so as I think about educating my patients, as one, sort of really trying to identify on a really focused level kind of where those personal levers of threat are for that patient. Are they an outdoor worker? Do I note on their medication list that they're on a medication that actually inhibits their thermoregulatory ability to appropriately respond to heat, and thus are more at risk for heat-related illness? Do I have concern that they don't have access to cooling, which going to a cooling shelter in the middle of a pandemic, again, carries enormously more complicated risk matrices that this patient has to face. So I bring those up as just sort of 3 examples, right? But those are 3 areas where I can have a discussion with a patient and try to provide really targeted information that will help equip them with the knowledge they need to not only protect their own health, but the health of their family and loved ones. And so that is making climate change personal, right? In the sense of them recognizing how it is impacting their day-to-day. And so I really try to look for those really high targeted, but really ability to have high impact alterations and improvements to their adaptability to climate change.
Thank you. And I think we'll just end with one more. Obviously, I mean, so many of these crises are ever unfolding, and there's so much uncertainty around what our best interventions are. And so I'm curious, I wonder if you can highlight just areas of research that you think are really important and sort of like in high need currently, either both for clinical practice or for sort of health systems and policy design.
Yeah, well, we will need an army of researchers in order to tackle that mass of the iceberg that is currently beneath the ocean. And so, I think that, again, heat is a extreme, or I should say a climate exposure pathway that I think we kind of understand best. But just the fact, right, that there's recent literature that highlighted a potential connection, right? More research is needed, but that connection to microbial resistance to antibiotics, or for example, was linked to increased prevalence of congenital heart disease. right? We need to not only think about each of these sort of exposure pathways and their, what haven't we detected, which a good way, right, to be able to rapidly begin to expand our knowledge base is for individuals who currently research some of these other areas, right, which people may think are not related to climate change. But can they add a specific aim to whatever it is they currently have a research infrastructure around what the impacts of extreme heat are? So, as we hopefully and collectively kind of build the research funding that's required to begin to build this knowledge base, we can take existing research infrastructure and begin to incorporate a climate lens into it. So we can begin to generate, again, new knowledge and understanding. So that's what I tell people who currently have research infrastructure. And I challenge any of you listening is how could you add a climate lens into what you're already doing, even if it's just another, sub-specific aim that you're going to tackle. But then also, again, sort of thinking about the interconnected impact. So we don't know, for example, but for pediatricians, kind of what the compounding impact is of all of these different onslaughts of health harms as related to climate change. And so what does it mean to kind of have these compounding impacts? Now it's kind of hard to tease out, right? And researchers are already thinking, well, there's obviously a lot of difficulty in doing that, but I think it can be done thoughtfully, and something we all sort of collectively, I know, are trying to think through. And then kind of the third piece, right, is thinking around healthcare delivery and this thinking about the very tenets of healthcare policy. So access, cost, and quality. There's numerous ways in which we can begin to improve our understanding, but also connect it to key stakeholders and make it personal for them so they understand why they truly have a stake in this, in tackling the climate crisis, because it does impact them. And the last thing I'll say is I make it a personal challenge to connect climate change to whatever someone works on, and I have yet to fail, knock on wood. And hopefully you shouldn't be able to either, because again, it sort of has some way to touch it directly, indirectly, or insidiously.
Thank you so much for that wonderful and inspiring talk and sharing your wisdom and knowledge with us. We're really grateful to you and your work.
Thank you. Well, again, it's our collective work together. So we are all in this together, and it's an honor to be here. And thank you for all of the work that all of you do as well. So it truly is takes an army of all of us to do this.